Yeah, I was struck by Scott's comments too about love being the solution. I mean, on the one hand, there's things to be optimistic about. The fact is, like, we see crime rates dropping all over and citizens caring for one another in all sorts of ways. On the other side, though, we just see a bunch of people who are out on the beach or going here or there saying it's my individual right to go do these things, not really caring about all the healthcare workers that are going to have to basically clean up their mess afterwards and maybe even take care of those individuals in the hospitals, and so on. And all these people on the front lines, healthcare workers risking their lives every day. And then you've got these people kind of, pretending they can just be impervious to all of that. I do hope, Scott, that you're right, that this becomes a moment in which we recognize, regardless of our views of government or libertarian or whatever, we are all in this thing together, and our health is only as secure as that of those around us. I think that was one of the original ideas behind President Obama's Affordable Care Act was exactly that kind of thing. And we lost our way a little bit, and hopefully maybe there's a way in which we'll get it back.
Oh, I have to take my dog out for a walk a few times a day, like everybody else who has a dog. Or you should just be taking yourself out for a walk a few times a day, because that's part of staying healthy also. And, I don't use an N95 mask because I don't want to take those supplies away from people who need them. I have, bandanas and other things I've fashioned, and I wear them because I don't want to get my neighbors sick. Now, I know enough about this stuff that a bandana is not going to stop me probably from getting the virus, all right? But what I'm trying to do is not get my exhalation on anybody else or out in the world. And so that's what that's about. I'm doing that for everybody else I see. And it gets really hard to walk around and see the people who are not doing that and go, well, I'm doing this because I care about your well-being, but you don't have the respect for me or the people in your world to reciprocate. And I want to get back out in the world as much as anybody. I want to go tell stories and make movies, and I want to get back to work just like everybody else. And to me, the shortest path to that is to try and get these numbers down and behave responsibly. Because one of the things, that we don't talk about in thinking how, when we say, well, let's open up. Well, let's say you own a restaurant and you're opening up. And you open up and you can only have tables 6 feet apart, and everything's going to slow down. Restaurants run on razor thin margins. We're going to destroy a lot of these businesses by forcing them to open up, and it's not fair to say to their employees who may be scared, you have to go back to work or you won't get unemployment. So this whole notion of just saying open back up is really misguided, and it's misguided from an economic point of view.
So Annie, suppose Scott's walking his dog and he walks past a guy. He's 6 feet away, no mask. And what do you have an opportunity to talk to that person and say something. Why should he be wearing a mask? He's 6 feet away. He's outside. He's not in a crowded restaurant or something like that. What's the case for it?
Well, because we don't understand asymptomatic infection at this point, and there are several indicators that suggest that asymptomatic infection is a driver, and that we don't understand how much it is right now. And so the best thing, just knowing what we do know, is to try to ensure that we're protecting each other. And if you protect your neighbors, you're also protecting your family and everybody else in your personal circle, because they may become exposed to somebody else. It's all we're all connected to each other. And I think that this is one of these things that where the more we realize how interconnected we are, the more we realize our social responsibility to each other. Because even if you want to be selfish about it, if you have to go to the grocery store, you still, are going to have potential for spreading to other people that are going to affect whether or not you can get your groceries, right? So if you want to even be selfish about it, be magnanimous with wearing a mask. It all comes back around.
Talk to the guy who says, look, I'm not going to touch you. I'm going to stay 6 feet away from you, and I'm going to be outdoors. Is there any example of someone actually getting infected in that situation?
Well, we don't have enough data yet, and that's the key. We don't have enough data, but data that we do have suggests that 6 feet isn't necessarily a magic number. It's never a magic number. It's a guess of what we think is the average distance that a droplet will go. But there have been studies in China and in the Netherlands, in a number of different places that are showing that there can be, that virus can spread over longer distances. And so this 6 foot window is just a best practice, of practical things that you can do. But, there have been several studies that show staying further away is better. And the cost of wearing a mask is so little compared to the cost of somebody else's health or life. And I think that that's what you have to break it down for other people, that there is their personal freedom of not wearing a mask worth somebody else's life. And if somebody else's life is somebody close to them, I often say to people, okay, well, pick the person in your life then you wouldn't mind losing to this over you not wearing a mask. Can you do that? Would you want to do that? I think that personalizing it is very important. And the problem with a virus like this is the existential threat of it. And if people are not seeing people dying close, I think that people in New York have a very different vision of this than people in Los Angeles. Or people in rural regions until they start seeing it happen to people around them. And so I think that therein lies the problem for us, is that for many of us, it's still a very existential threat.